Hello, and welcome to the Orion Beaumont Health Series. My name is Janice Hercula, and I'm a cardiology nurse at Beaumont Hospital. Today, I'd like to discuss with you how you can live a full life with congestive heart failure. If you have heart failure, you are not alone. 5 million Americans have heart failure, and we are here to help. What is heart failure? Many people misunderstand what heart failure means. Heart failure does not mean that your heart has stopped or is about to stop working. Your heart still beats, but it's pumping less nutrition and oxygen-rich blood to the rest of your body. Heart failure can make you feel tired and weak. Heart failure can cause swelling and fluid buildup in your legs, feet, and lungs. This fluid backing up in your lungs is sometimes referred to as congestion. This congestion is why it is called congestive heart failure, or CHF. Heart failure can make you feel many different ways. You may feel short of breath, wheezing, or coughing with activity. You may feel fatigued or lack no energy. You may notice you have a problem breathing when lying down. You wake up at night coughing or short of breath. You have swelling in your ankles, legs, feet, or stomach. You may feel your heart beating rapidly or heart palpitations. You may notice a weight gain or a loss of appetite. Some important facts about heart failure are: heart failure is an illness that cannot be cured, but with careful management, it can be brought under control. It's important to follow your doctor's instructions, and this will allow you to live a full life. When you have heart failure, it's important to take care of yourself. It is important to follow the plan that your doctor has created for you. The key parts are diet, exercise, medication, and lifestyle changes. If at any time you don't understand something, it is very important to ask your doctor to clear it up for you. Always check with your doctor before you make any changes, especially with medications. By following the plan closely, you will feel better and stay healthy. It's important to keep a routine. Every day, you need to weigh yourself in the morning before breakfast and jot it down. You need to take your medications as prescribed. You need to check yourself for any swelling in your legs, ankles, feet, or stomach. It's important to follow a low-salt diet and to balance exercise with rest periods. As we look at daily weights, it's important to keep a log of these weights. You should weigh yourself every day at the same time, preferably first thing in the morning, and you should weigh yourself either without clothes or very light clothing. You should weigh yourself after you have used the restroom, but before breakfast. It's very important to notify your doctor or nurse if you have either of the following. If you have a weight gain of 3 pounds or more in one day, or a weight gain of 5 pounds or more in 1 week. Along with keeping track of your weight, it's very important to keep track of your symptoms, and it is recommended that you use a calendar. Keep a daily log of how you are feeling. Are you tired or fatigued more so? How is your breathing today? As you mark your weight down, has there been a weight gain? And have you noticed any swelling? On to the right there, you will see that on Monday, this patient weighed 167 pounds. But as we scoot to Tuesday, there was a 1 pound weight gain. Not enough to call their doctor, but keep track of that for the week. He had some mild swelling, but he was breathing okay. And as you see, that didn't change from one day to another. So he will continue on with his daily routine and again weigh himself the next day. Another very important part of treating heart failure is to make sure that you take all your medications as prescribed, even when you are feeling well. Never skip doses and plan ahead for refills. It is important to watch your salt intake. Sodium or salt causes you to retain fluid, which can worsen your heart failure. We recommend you eat a low salt, low fat diet. It is recommended that you keep your daily salt or sodium intake to 2,000 milligrams or less a day. You're going to learn to read food labels and to learn what foods are high in salt and to avoid them. To understand food labels, on the screen here it says, can you guess how much sodium is in a cup of this food? As you see under nutrition facts, it says serving size 1 cup. That is important because this type of food has 2 servings per package. And the question is there 30, 250, or 470 milligrams? And as you see at the bottom of the box, it says sodium 470 milligrams. So 1 serving of this item will equate to 25% of your daily sodium or salt intake. It's important to know what foods that are extremely high in sodium or salt and to avoid them. Pretzels and chips, ham, bacon, sausage, lunch meat, canned foods, frozen dinners, most cheeses and buttermilk, seasoned salts, meat tenderizers. We have to look at condiments such as ketchup and mayonnaise, and sauces and salad dressings. So we need to always look for healthy food choices. Fruit and vegetables are a great choice. Eating heart-healthy nuts, snacking on walnuts or almonds, eating whole grains. We want to eat lean protein as much as possible, chicken, fish. And we want to look at our dairy to make sure that it's low fat and low salt. A very important part of heart failure and treating it is that we need to exercise that heart muscle. Heart failure patients need to keep their heart strong. Your heart is a muscle, and exercise can help make it stronger. Exercise has other benefits also. It can help you reduce your heart failure symptoms. It can help you get rid of stress. You will feel more energetic, and overall you will have better circulation. We need to exercise safely when we have heart failure. It's very important to always get your doctor's permission. We recommend that you exercise at the same time each day so that it becomes a habit. We need to wear flat shoes and comfortable clothing. We recommend that you don't exercise when it's too hot outside or too cold outside. We recommend you don't exercise after just eating, and if at any time you feel ill. We recommend that you avoid exercises where you need to hold your breath or lift weights. Your overall goal with heart failure is to be in the all clear zone. That won't always happen, but that's what we strive for. The green zone indicates that everything is good to go. So we would expect you to have no shortness of breath, no chest pain, no weight gain more than 2 pounds in one day, and no swelling in your legs, ankles, feet, or stomach. The warning zone is just like the yellow zone on the traffic light. We recommend that you call your doctor if you have any of the following: the weight gain of more than 3 pounds in one day, or a weight gain of 5 or more in 1 week. If you feel that you are more short of breath, if you've noticed more swelling again in your legs, feet, ankles, or stomach, if you're feeling more tired than usual, if you have any dizziness, any dry hacking cough, or if you've noticed now that when you lay down you're having difficulty breathing. The red zone we identify as the emergency zone. When you have these symptoms, it is imperative that you go to the emergency room or call 911 for the following symptoms. If at any time you are struggling to breathe, if you have developed some chest pain, or when sitting still you have unrelieved shortness of breath, or if at any time you're confused or you can't think clearly. Other tips to treat your heart failure include: we ask you to quit smoking, limit or avoid alcohol, and manage stress. As my little green friend here says, relax. It's a healthy choice. Living with heart failure and heart disease is very possible, but it means that you have to accept your state of health and you need to actively manage it every single day. We would like to invite you to join our free heart failure program for education and activity. We will offer you a better understanding of your symptoms and treatment for your heart failure, information on your medication and why it is prescribed for you. We have a dietitian that will speak to you about healthy eating. We offer some exercise and exercise guidance. We offer suggestions for stress management and much more. Beaumont's Living with Heart Failure Workshop is a free 4-week program. It meets twice a week on Tuesday and Thursdays. The times is 1 to 2 p.m. and they meet at the Beaumont Hospital, Troy Cardiac Rehab. We offer you a complimentary valet parking to attend. Our heart failure workshop, if you would like more information or to register, please call the Troy Cardiac Rehabilitation Department at 248-964-8520. Again, that number is 248-964-8520. And we will assist you in obtaining permission from your physician or nurse practitioner so that we can get clearance for you to attend this program. Living with heart failure is very possible, and living a full life. And I'd like to thank you for watching this program today.